Certainly in the U.S., as with most countries, the government is the payer for vaccines. So the pricing really is certainly in the U.S. is contingent on two things. Firstly, people that are going to get their vaccines through government programs, which is a little bit over 50% of the population, will get it for free. So it'll cost the government about $40 per 2 doses, about the same as the flu shot. So that's a nice match. And for those people with private insurance, again, that will be covered through their insurance. There'll be very little or no copay. So the $40 mark seems to be right on the money relative to what payers want. And that's crucial because if the vaccine is not affordable, too many people will not get vaccinated. And that's important because, as you just heard, in the U.S., many communities of color are suspicious. There's a cohort of people in the U.S. don't believe in vaccines. So we need to not just to get the vaccine and make sure it's safe and effective and manufactured to scale, but people have to get it, because having a vaccine that nobody gets is not a victory.
No, absolutely. You need to make the vaccine more affordable. I want to compare and contrast how vaccine pricing compares with normal drug pricing, because for a lot of patented drugs, and there would be an IP attached to these vaccines that are coming out, a lot of patented drugs after 180 days of exclusivity go out as generics, and obviously that makes it far more affordable for developing countries to manufacture these drugs. What is the mechanism that's followed in vaccine trials? Can it be, or vaccine development rather, can it be about selling the IP and then producing the vaccine at mass scale?
Well, what we've learned over time is that nobody gets rich being exclusively in the vaccine business. The reason that we're succeeding now with so many shots on goal, so many companies in the game, is because it's a pandemic. It's an all hands on deck proposition. I believe that the $40 price point will allow all of these companies, whether it's Moderna, Pfizer, Johnson & Johnson, Merck, AstraZeneca, what have you, to make a profit, because you want to reward innovation. These companies have taken tremendous risks, not just in their development programs, but also in manufacturing at risk. And unless you reward innovation, you don't get it. So I think that the government partnering with biopharma, as well as government ministries getting in the game as well, shows that a fair profit can be made. The products can be priced fairly, and certainly for the developing world, where vaccines have really been their strong suit relative to improving public health, it can be done at low or no cost, both through the biopharmaceutical developers as well as through third parties such as the WHO.